Hello, I'm Dr. Ken Landau. Thanks for watching. Let's talk about Lexapro, or is generically known as Escitalopram. The drug was approved by the Food and Drug Administration in 2002, and generic drugs became available after 2012. It's an SSRI, a selective serotonin reuptake inhibitor, just like Prozac or Zoloft or Paxil. It's used for the acute treatment of, or the maintenance treatment of, depression in adults and in adolescents between the ages of 12 and 17. It's also used for the treatment of generalized anxiety disorder for a period of up to about 12 weeks. The drug was marketed in the United States by Forest Laboratories, but it was actually discovered by a pharmaceutical corporation in Denmark known as Lundbeck. It came on the market in 1998 as Celexa. And what happened is that Forest Laboratories started looking at the Celexa, and they discovered that there were actually two different chemicals, mirror images of each other. In the Celexa, one of them, the left-handed image, was active. It was 100 times more active than the other component, the right-sided, or the R enantiomer, and that was inactive. So what's the difference between Lexapro and Celexa? The difference is quite simple. Lexapro got rid of the 50% of the Celexa that was inactive, so it brought out just the active ingredient. That's the only difference. They're both selective serotonin reuptake inhibitors. They both contain the same active ingredient. Now, when we look at all of the SSRIs, the Prozac, the Celexa, whether we're talking about the Paxil or the Zoloft, they all work the same way. They might have little minor variations on how they work on dopamine, how they work on the noradrenaline, but basically they are exactly the same kind of molecule. Now, if we look at other areas of the world, the drugs are approved for other purposes in addition to the anxiety and depression. So if we go to Europe or if we go to Australia, drugs also used for panic disorder, agoraphobia, obsessive-compulsive disorder, social anxiety, off-label for post-traumatic stress disorder, fibromyalgia. Some of the drugs in the United States, just Prozac, approved in addition for treatment of PMS, premenstrual syndrome, can be taken either daily or just for the 2 weeks before the period. Sometimes people use the drug for treatment of or prevention of migraine headaches. Doesn't work. It's used specifically in the United States, let's say, for major depressive disorder, but it isn't the same thing as the colloquial, oh boy, I'm depressed, I need a pill. Now, for the medical definition of depression, you have to have symptoms for at least 2 weeks. They have to be persistent. They have to interfere with your normal activities. And you have to have at least 5 symptoms, like depressed mood, or loss of interest in your usual activities, or change in your appetite, either increased or decreased, change in your sleep, either you sleep too much, sleep too little, change in your activities, either you're hyperactive or you seem to sit in the chair and not do anything, increased fatigue, feelings of guilt or worthlessness. You have to have slowed or impaired concentration, maybe even think about suicide. That's how we make the official definition of depression. Anything less is not depression, at least by definition. So how does the drug work? How does Lexapro work? Well, it works okay. It's nothing great. Actually, 4 studies were done initially. One of them showed it was about the same as a placebo, and the other 3 showed it was a little better than placebo for both the treatment and the maintenance of depression. Actually, if it seemed to work and you took it for a long enough period of time, the depression might come back in some of the people. If we look at the total effect, it seemed to be effective in about 40–50% of the people in reducing the symptoms, not getting rid of the symptoms, just reducing the symptoms of depression. But placebo seemed to be effective in at least 35% of the people. So it's not a home run. And it doesn't make any difference which one of the many different kind of rating scales we use. Basically, they're all the same, at least as far as the outcome is concerned. The drug Lexapro is a little bit better than placebo. However, it's important to realize that most of the studies that were done were conducted by the drug companies or funded by the drug companies, and when looking at the studies by the unbiased experts, were thought to be of either low quality or at best modest quality. And there's another issue. You can either have major depressive disorder by itself, or sometimes you can have depression that could be one of the first manifestations of bipolar disorder, where you can have mania, manic attacks, and depression. Well, if you treat the depression of the bipolar disorder with this drug, or any of the members of the SSRI family, might precipitate acute attacks of mania. Obviously not good. So caution is required. Well, how does it work for generalized anxiety disorder? Again, you have to have the medical definition. So for at least 6 months, you have to have persistent symptoms that are difficult to control, feeling restless or keyed up or on edge, being easily fatigued, or difficulty with your mind going blank, or irritability or muscle tension. Sometimes you have a sleep disturbance. Again, multiple studies done, and it's a little better than placebo, but again, not a home run. Medicine comes in either 5, 10, or 20 milligram capsules. When you look at the standard dose, it's 10 milligrams for depression. Could be increased to 20 milligrams, but a dose of 20 milligrams doesn't really seem to provide any extra benefit than 10 milligrams. And certainly if you have anything wrong with your liver, your kidneys, 10 milligrams is max. 10 milligrams also is the standard dose for anxiety. Should not be abruptly discontinued if you've been taking it for a while because of some other kind of symptoms. And additionally, it's important to periodically reassess the need to be on the therapy. We know that the anxiety or the depression may well be situational and can fluctuate. Well, the good news is the pill Lexapro can be taken once a day. It can be taken with or without food. If you have depression, you might have to take it for weeks to months before it's maximally effective. And the discontinuation rate of therapy is about the same as if you were taking a placebo drug. If you happen to be pregnant, you probably shouldn't take the pill, because if you're pregnant, especially if you're in the 3rd trimester of pregnancy, you can have a child with low birth weight, autism, low blood sugar, cyanosis, apnea, seizures, respiratory distress, and certainly in women who are breastfeeding, it's not recommended to take the drug because there's some problem with weight loss and fussiness and somnolence in the child, decreased feeding. It's not for children under the age of 12. All drugs associated with some kind of side effects, and the side effects are pretty much standard with all of the drugs. Nausea, sweating, fatigue, feeling tired. There's no change in weight, so it's not a diet pill. Some people can have the mania or the hypomania, although that's relatively unusual. But it's not unusual to have sexual dysfunction, especially if you're a man. Lack of orgasm, decrease in libido, or even ejaculatory delay. It's not a narcotic, so we're not really worried about abuse and dependence, but you could overdose on the drug. Fortunately, it tends not to be serious unless you happen to be taking other drugs as well. Shouldn't take it within 2 weeks of taking an MAO inhibitor, Marplan or Pardil, let's say, for treatment of depression. You don't want to take it with another drug called Pimozide. If you happen to have seizures, may worsen the seizures. And sometimes the drug can decrease the sodium in the bloodstream, and if it does that, you could develop headaches or difficulty concentrating, or you could have certain unsteadiness or fainting attacks, or at worst, you could go into a coma. So do have to be careful about what the sodium is. Well, another issue is that serotonin is important for platelet function. Platelets are the things inside your bloodstream that make you clot. And if you take a selective serotonin reuptake inhibitor, like Lexapro, might interfere with the clotting process. So if you have a tendency to bleed, if you're taking aspirin, or if you're taking warfarin have to be careful, certainly if you have gastrointestinal bleeding disorders. And if you happen to have a narrow angle inside your eye, taking the drug can precipitate an acute attack of angle closure glaucoma. And there's a big black box warning on the drug that it might lead to an increased thought about committing suicide, especially if you happen to be less than 24 years of age. Not so if you're an adult, not so if you're a senior citizen, but in relative youth, it seems there is an increase in the incidence of contemplation of suicide. So have to be careful. Sometimes it's associated with a change to that mania I mentioned a moment ago, but other times it might be associated with panic attacks or anxiety, irritability, aggressiveness. Not honestly sure why or who is going to suffer the problem. Another issue with these drugs, with Lexapro, is that it might cause what we call the Serotonin Syndrome, especially if you happen to be taking it with migraine headache drugs, the triptans or a tricyclic antidepressant, or if you're taking a drug like fentanyl or lithium, or you're taking even St. John's wort. Well, if you're taking any of those drugs, or if you're just taking the Lexapro by itself, you could suffer agitation, hallucinations, delusions. You could have increased heart rate, your blood pressure can go up, you can start flushing and feeling dizzy, elevated blood temperature, body temperature. You could have some tremors, you could have muscular rigidity or seizure disorder. You could have nausea, vomiting, diarrhea. Fortunately, there doesn't seem to be much interference with metabolism of most drugs when you take this particular compound. But interestingly, it interferes with metabolism of codeine. Now, if you're taking codeine for pain, codeine by itself is what we call a prodrug. It's not active. In order for codeine to relieve your pain, it has to be metabolized into morphine. And Lexapro prevents that conversion. So that means that if you're taking codeine for pain, it isn't going to work if you're taking the Lexapro. Well, there's another issue that I mentioned, and it has to do with discontinuation. If you stop taking the drug abruptly, you've been taking it, say, for weeks or months, and now you just decide, hey, I don't want this drug, well, you might have the mania that we talked about, or lethargy, or headaches, or confusion, or anxiety, or dizziness, or irritation, or agitation. Sometimes people get what are known as brain zaps, feeling like you have electrical shocks. Or sometimes it's just acute depression that might come back. Well, in studies, before it became marketed to people, in laboratory animals, it was shown to increase the incidence of carcinoma of the small intestine. So if you happen to have a history of cancer, not so sure about this kind of drug. Well, the drug was phenomenally successful. While it was under patent, it brought in about $14 billion. In 2011, the year before it went off patent, it brought in $2 billion alone, and it accounted for about half of all of the income of the drug company, Forest Laboratories. But now 90% of the drug is generic. So how does it rate? Does it rate any differently than any of the other antidepressants on the market in the family? Is there anything special about Lexapro? Well, the American Psychiatric Association and what's known as NICE, or the National Institute for Clinical Healthcare and Excellence in Britain, says no, all of the drugs, whether we're talking about the Prozac or the Paxil or the Zoloft or the Luvox, all seem to be the same. Maybe a little bit weaker than Effexor or Cymbalta, according to some people. Well, the drug company, Forest, they sort of got into a heck of a lot of trouble early on. They seemed to be promoting its off-label use for children, even though there was evidence that the company had and hid that the drug didn't seem to work in kids. So as a result, they paid the Department of Justice about $300 million. Forest Laboratories is known for acquiring compounds and then marketing them here in the United States, and then somehow moving the profits offshore. And that obviously is an issue. Forest Laboratories was bought by another offshore company known as Actavis. It was purchased for about $25 billion, so we're talking about big money in these companies, in 2014. Actually, interesting, when they were in trouble, they had to release about 270 pages of their marketing agreement, or their marketing plan, to the Senate Committee on Aging. And they released about 88 pages to the public that showed how the company was going to spend about $70 million to fund doctors, family doctors and psychiatrists, to go out and tell their peers how great the drug was. The drug Lexapro was launched, actually had the 6th biggest launch in pharmaceutical history, even surpassed Viagra according to some people. There are about 35, 40 different drugs in the field to treat depression, and this single drug garnered 13% of the market. Supposedly the drug was superior to the others if you believe the advertising, but the advertising was sponsored by the company. And as a matter of fact, as we just mentioned, according to the American Psychiatric Association and Drug Regulatory Agency, Health Regulatory Agency in Europe, it's no different than any of the other drugs in the family. It's just another SSRI. What's the current cost? Well, you could go buy Lexapro. If you put up the cash right now for a month's supply, it's about $370. And if you had a coupon, say, for instance, from GoodRx, it would be about $340. But if you went over to the drugstore and you had, again, a coupon from GoodRx and got the generic version, instead of $370, it's only $10 to $20. So what's the bottom line on the drug? The bottom line, it's no better than any of the other SSRIs. It's highly overprescribed. In America, for every single complaint that we have, we go to the doctor and want some kind of a pill. The question is, do we really have depression? Is the diagnosis correct? Do we really have generalized anxiety? Is the diagnosis correct? Do you really want one of these pills that's associated with some of the side effects? And the answer is, we're doing it all the time. And unfortunately, we're often doing it incorrectly. Anyway, something for you to think about. I'm Dr. Ken Landau, and thank you for watching.